Skin cancer is caused by the abnormal growth of skin cells, and it's usually those that have been exposed to the sun. The American Academy of Dermatology estimates that 1 in 5 Americans will develop skin cancer in their lifetime. You can reduce your risk of skin cancer by limiting or avoiding exposure to ultraviolet sunlight and checking your skin for suspicious changes. Dr. Samuel Moak at Lake, Ear, Nose, Throat, and Facial Plastic Surgery knows that early detection of skin cancer gives you the greatest chance for successful skin cancer treatment. He talked to us about the different types of skin cancer you should be aware of.
So that occurs from sun damage. 3 main types. There's melanoma, which is the worst, squamous cell carcinoma, which is the second worst. Very rarely can metastasize and spread further. Then basal cell, which very, very rarely can change into something malignant and metastasize, but is more locally aggressive, and particularly in high real estate areas of the facial anatomy. It can be destructive to either the eyelid, perhaps, or the nose, or the lip, and ruin a lot of the very delicate architecture of those areas. I think that there's a huge population out there that is part of that generation, and that now they've reached this age where they're sort of reaping what was sowed. I even noticed my own people in my own family say, "Oh, did you put on your suntan lotion instead of sunscreen or sunblock?" And that's kind of from that older cultural practice of trying to enhance the UV penetration into your skin and tan faster. Then likewise, when I was growing up, tanning beds were very popular. And I think now those still exist, but you also see an equal amount of spray tan places and a big focus on putting on sunscreen. I think we overall are more educated, but there's just this huge group of people that are in the process of developing skin cancers that requires us to be vigilant on the front lines to treat. Any lesion that's growing in size rapidly, crusting, scaling, itching, bleeding, causing any kind of pain, needs to be evaluated by a professional.
Melanoma accounts for about 75% of all skin cancer fatalities, and it's more common in people with white, fair skin and those who have experienced high levels of UV exposure. But it can also appear as an abnormal mole or look like a bruise that doesn't heal. To help spread awareness, the American Academy of Dermatology promotes the first Monday in May this year, May 4th, as Melanoma Monday, the official start of melanoma skin cancer detection and prevention month. In their Spot Skin Cancer program, they encourage people to check loved ones for suspicious moles or spots, which should be examined further by a healthcare professional. Here are some of the ABCs of what to look for. A. Asymmetry. Is the mole asymmetrical or an unusual shape where both sides don't mirror each other? B. Border. Does the border or edge of the mole look uneven? C. Color. Is the mole one uniform color, or are there several colors or shades within a mole that could be a warning sign? D. Diameter. How big is the mole? Melanomas have a diameter of about 6 millimeters, about the size of a pencil eraser. E. Evolving. Has the mole changed in shape, size, or color? Have you noticed any other changes such as bleeding, itching, or pus coming from the mole? If any of these signs apply to you, seek medical attention as soon as possible. For links to information on melanoma, as well as links to the specialists at Lake, Ear, Nose, Throat, and Facial Plastic Surgery, please click on the ABCs of Melanoma story link on our homepage at yourhometownhealth.com.